Hi all, in this particular video we're going to actually discuss different directional terms that we would use every day in dentistry when we're working chairside with the dentist, dental hygienist, or dental assistant. Okay, so you'll see that I have my nice little mouth model here, and what I've done is I've drawn a line to identify or differentiate the midline. Because essentially what we do is we have four quadrants. We have quadrant 1 over here on the upper right, or UR for upper right. Then we have quadrant 2 over here for the upper left, or UL for upper left. Then we have quadrant 3 over here on this side, and that is going to be the lower left, or LL for lower left. And then we have quadrant 4, and that is going to be the lower right, or LR for lower right. Now, when we also number the teeth, with the universal numbering system for the adult dentition or permanent teeth, we number them 1, starting over here. This particular model is actually missing the third molar, so you notice there's just two. You'll notice that there's just 2 molars there. So we're actually missing tooth number 1. So it would start with number 1 on the upper right, the patient's upper right, and then it goes all the way around to tooth number 16 would be the third molar. And then for the lower, it would be tooth number 17 for the third molar, but otherwise 18 for the second molar, 19 for the first molar. And then it goes on all the way over to number 32 would then be the third molar on the lower right side. Okay, so that pretty much goes through the quadrants and the teeth numbers using the universal numbering system. So now let's talk a little bit about directional terms, okay? So you'll notice that I have the facial notated right here. Now the facial can mean anywhere along the entire facial aspect of the mouth, right? Now we can break that down further, that general facial term, and we can say that anything that is closest to where the lips would be referred to as labial, or anything closest to where the cheeks would be on either side, it would be referred to as buccal. So our abbreviation for facial would be just using an F. Our abbreviation for using the labial would just be an L, or our abbreviation for the buccal would be just using the B, okay? So now let's talk a little bit about the inside of the mouth. So you'll notice here we have the palatal surface, so that's going to be closest to the palate. Now in general, most of us don't use the term palatal. Instead, what we'll do is we would just use the general basic term of lingual. So that's going to be closest to the tongue side. So on the bottom, closest to the tongue side, that's going to be lingual, or L. Or on the palatal, that's going to be up on the maxillary palate, and that's going to be a P. So those are going to be our directional terms. Now there's some other directional terms that we would use when referring to the teeth, and that's going to be your mesial and your distal, okay? So each tooth is going to have a mesial side and a distal side. So what we do is essentially draw a line right down the middle of the tooth, and anything that is running closest to the midline, so this part of the tooth, this part of the tooth, this part of the tooth, that's going to be referred to as mesial, okay, or M. Anything going away towards the back of the mouth, that's going to be referred to as D, or distal. So that's going to be this area here, 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 and so on, moving back into the back of the mouth, okay? So that's how you differentiate identifying characteristics inside the mouth. So you're going to give them facial points of reference. So you're either going to say the distal facial side of tooth number 8, or you would then say the distal lingual side of tooth number 8 would of course be right here. Okay, so now we also have other identifying reference terms as for the anterior teeth, the part of the tooth that is closest to the edge, that is known as the incisal edge, okay? Because those are all either going to be incisors or canines, so that's where the term originates from, is incisors. So it's going to be the incisal edge from canine to canine. Otherwise, we're going to have on the posterior teeth, on the molars and the premolars, that says occlusal. So on the posterior biting surfaces of the teeth where the teeth bite together, that's going to be known, the posterior teeth is going to be known as the occlusal surfaces, okay? So those are all of our directional terms that we're going to use. So when you use the incisal, you're going to abbreviate it as an I, and then when you use occlusal, you're going to abbreviate it as an O, okay? So those are going to be all of the directional terms that we use when talking about the different areas inside of the oral cavity, okay? So knowing where the midline is, that's going to be very important. So essentially, if you were to draw a line all the way down the middle and then all the way across, that's what helps to differentiate the 4 different quadrants that you have in the oral cavity as well. Hopefully you guys find this helpful, because these are going to be the terms that you guys are using every day in the world of dentistry.